Dankeschön.
Thank you for your question.
Sorry, we are experiencing some technical issues, so I will try to make... okay. Thank you, Andy, for your introduction of BMC Company. I will be more on scientific issues. Here is a plan of my presentation. I will first discuss how obstructive sleep apnea is a worldwide burden, and in the second time, how telehealth can help us get a better treatment for the patient. As Dr. Ben Benjafield published in 2019 in The Lancet, more than 1 billion people suffer from OSA in the world. In Europe, more than 30 million patients are still undiagnosed. For France, we know that more than 1.8 million patients are under PAP therapy. For your information, we are around 6,000 French prescribers of PAP therapy, so it represents more than 3,000 patients per prescriber. I will let's focus on the data of the Alaska study published by Jean-Louis Pépin in 2021 in the Journal of Clinical Medicine. 480,000 patient data from the French National Social Security before the time of mandatory telemonitoring for healthcare providers. We know that at 3 years after the PAP initiation, we have around 50% of CPAP termination. That's so bad when we know some of the arguments of the efficiency of the therapy and hospitalization rates and emergency room visits. I simply remind you of this study by Malhotra in the Annals of American Thoracic Society in 2023. The more you use, the more you reduce many medical issues, except for patients over 9 hours, but I won't come back on this particular medical situation, which have been quite well explained in other studies, in particular by our cardiologist colleagues. In this study by Weherle in Somnology in 2017, a proactive management strategy, meaning telemonitoring of PAP usage and phone calls by the HCP each 2 weeks during 6 months, can halve the number of PAP therapy discontinuation at 1 year. In 2020, In 2020, Chen published a meta-analysis of studies comparing a standard in-hospital supervised PAP titration versus home auto-adjusting pressure titration. The results showed that telemonitoring care group compliance was significantly higher than in the usual care group. Except in special medical situations, it's therefore not at all justified to keep in-hospital titration. On the contrary, we must make full use of the telehealth at our disposal. In 2023, in this study by Cohen, published in Sleep and Breathing, we can follow the evolution of PAP usage over the time. We can see an explosion of low usage from the first 2 weeks with a gradual reduction in medium usage. Overall, high usage remains stable. We can ask ourselves if, after 1 month, the gains are not already down, and if it's not essential to have all the means to act very quickly. Telehealth is also an essential tool for the empowerment of our patients. Donovan conducted a qualitative study in 2021 with 35 semi-structured interviews. They were able to identify 5 main themes in the patient experience: improving access to care, security and privacy, personalization of care, patient empowerment, but they highlighted also some lacks of telehealth, especially the lack of physical follow-through and physical examination. BMC has developed a complete ecosystem for the therapy data management. For the prescriber and HCP, we will use the web version of PAPlink to track therapy data and remotely change settings of PAP devices. The PC versions allow to view detailed data from SD card. For the patient, a smartphone version called PAPlink app allows the patient to view the therapy data, generate a report that can be sent to his physician or HCP. In the future, he will also have access to motivational and therapeutic education content. There is an automatic and timely data transmission from device to cloud. The data upload can be done by multiple ways: 4G cellular modules, Wi-Fi modules, or PAP-Link app with QR code scanning. You can also use PAP-Link Uploader. It can also help you with the simplest SD card data to cloud solution that I have tried myself. All the data go on the new PAP-Link web. On the PAP-Link web dashboard, it offers you a snapshot of your patient compliance and therapy status at a glance. You can customize your filter rules and do early intervention. You can also remotely view and adjust therapy device settings. This feature supports patient adherence and ensures optimal treatment outcomes. On PAP-Link webs, it includes also various templates, statistics, and detailed data. The website is quite really user-friendly, even for first-time users. In the future, PAP-Link Web will be the heart of the system for patient management, including prompts, patient coaching, remote assist, and all BMC devices around the patient, from diagnosis to therapy, for example, CPAP or oxygen concentrator. Now I will present you the new G3 devices with his new modern design. In Black Edition, you have the CPAP or auto CPAP therapy. In the White Edition, that's for the bi-level therapy. I will let you discover the humidifier, which is for me the easiest to use in the market in France in any case, and I invite you to come and discover it directly on the BMC booth during the Congress. It has a very simple push-push system to disassemble the humidifier and a single 2 fingers opening. There is also a smart ABC technology. This smart ABC technology allows you to automatically adapt the therapy pressure based on actual night data, allowing for faster and more effective home sleep titration. The therapy pressure is adjusted per 5-day windows of effective therapy. For Smart C, for CPAP, the device only adjusts the pressure according to the data within effective treatment days. What we call effective treatment days is treatment time over 3 hours and time of large leak below 5% of the total treatment time. And that's the effective treatment day. When you enabled Smart C, at the very beginning of the treatment pressure is performed according to the set value of treat P. And after 5 effective treatment days, we are based on the average obstructive AHA and snoring index of the last 5 effective treatment days. The new treatment pressure, the Smart P, is calculated and performed for the next period. And the adjustment is from -3 and +3 HPA from the P you have determined at the beginning of the treatment. There is also a Smart A for auto CPAP mode. When you enable the Smart A function, the initial treatment is less. When the initial treatment is beginning, it will, with less of 5 treatment days, the device provides the treatment pressure based on the setting of Min APAP and Max APAP under auto CPAP mode. And after 5 effective treatment days, the device calculates and provides the pressure parameters of Smart A based on the statistics of the last 5 effective treatment days. There is also a Smart B for bi-level on the same principle. In the last years, a very important work has been done by the R&D of BMC to improve the treatment algorithm. The new version has a better flow limitation detection and is now able to identify the type of hypopnea, score RERAS, and detect periodic breathing. On behalf of BMC, a comparative study has been conducted by a third-party testing lab in France called Kernel Biomedical. I present you the evaluation protocol carried out on major competing devices, Essence S11, DreamStation 2, Prisma Smart Max, and SleepStyle from Fisher-Paykel. The detailed data will be published in a white paper in the coming weeks. Now, I will let you introduce a real patient case of using BMTG-3 devices and management by PAP solution. So I present you Mr. Patrick. He's 45 years old. It has been referred to my office by his cardiologist due to difficulties in blood pressure control. On the BP Holter, he still have a grade 2 high blood pressure, still night deeper. On the ultrasound, we found a he has a good left ventricular function. In his medical history, he suffered from high blood pressure, chronic bronchitis, and had an adenoidectomy in 1969. His father has some cardiovascular issues with an ischemic heart disease and a transient ischemic attack. Mr. Patrick is very sedentary. He has stopped tobacco very early, but he's still in the French paradox, still drinking 2 glasses of wine, and there's no problem for him. He's a bit overweight. About other symptoms, he has morning headaches, suffocation, heavy snoring noticed by his wife, and even self-awakening. He's a bit sleepy with an pulse at 12, no depression, no fatigue, and some worse breathing. The PSG is very clear with an AHE at 41 and ODI at 36. We decided to set up a BMTG-3 with an NSYS nasal mask. The HCP made an hop sleep titration with IPAP from 6 to 15 and a smart mode. I start a smart A mode. At 7 days, the HCP conducted a at-home visit and transferred me the detailed data with the PAP-Link uploader. He also gave me these feedbacks. The patient is less tired, has fewer headaches, and no dry mouth. Madam is quite happy. He is less grumpy. His husband is less grumpy. He has no particular problem with the PAP device. The usage is okay with 6 hours per day. The average P is okay. The residual AHE and leaks are also okay. Smart A is from 10 to 16. I checked the data, the detailed data on the PAP-Link web. On the front page, you can have direct access to the summary of your different patient. And at a glance, you can check the main treatment issues, high AHE, high leaks, and low usage time. If you click there on the pencil, you can, by yourself, modify the rules of presentation according to your needs. Here are the summary graph, the duration of usage and the period of usage. So we directly notice the usage is quite good on the first 5 days. On the 3 last days, we can notice a lot of interruption during the night. At the same time, we also notice more leakage, but at the same time, we can also notice more leakage, but with a good residual AHE. The pressure is already a bit high with a mean pressure at 14. Here are the detailed diagraph with pressure trends and respiratory events, hypopnea, central sleep apnea, and obstructive sleep apnea. Just for information, that's not the final version of the detailed graph. A big new update is planned at the end of the year with the other graph for flow limitation, RERA, periodic breathing, and type of apnea, of hypopnea. You can also edit a treatment report with the selection of the detailed graph you want on your report. You can also personalize the report with your logo and name of sleep lab. For my example, I put my logo of my sleep lab and the name of my sleep lab directly on the report. There are different templates of reports also available depending on your needs. You can also check the device settings, view the setting history, and modify it directly online. At day 12, the patient called me back because he's suffering from dry mouth and a feeling of too many pressure. Okay, I was out of my office for some days, so I asked him to send me a report with his PAP link app by flashing. There is a small code on the G3. You can flash at the end of the night. You flash the code, and all the data will be in the application, and you can create a report and send it to you to your HCP or prescriber. So I put you 2 screenshots with the current settings of and the usage report of the patient. He sent me a report, but okay, for this report, that's not the real report of the patient because he didn't send me the PDF, but just screenshot, so the quality is was not very good, not very a very good quality to show you today. But for the real results of our patient, the leaks were really too high, especially at P95. The average P is at 16, the P95 at 17.5, so I could confirm the increase of the pressure due to the Smart A function. So I decided to remotely modify the setting and stop the Smart A and downgrade the sensitivity to 3, because on the G3 you can choose the sensitivity for determination of the residual events. At 1 month, we made a systematic consultation at my office with the patient and the HCP, so we could check the detailed data on the PAP link PC version. On the mainframe, you can check the duration of usage, the mean pressure, the P95, the residual AHI, and the leaks. You can also check the data of therapy, the pressure trend, the flow, the leaks, and the respiratory events. You can also modify on the right of the slide, you can modify the device setting on the SD card. At the end we had no particular concern after the last therapy settings, and planned the M4 regulatory renewal in France. The first prescription is for 4 months, so we have to see the patient at a time at 4 months to remake the prescription.